if there is a perforation which needs to be sealed, which you touched upon, are there any surgeries available for these kind of problems? And if somebody has already suffered a hearing loss due to any kind of problem, whether it was the infection or the eardrum problem, can we help in terms of any hearing aids? On the same lines, Karuna Pramodji is asking how to communicate with people with hearing loss. जोर से बात करनी है या कोई स्पेसिफिक तरीका है ऐसे लोगों के साथ, उनकी कंडीशन के साथ डील करने में, स्पेशली जो एल्डरली लोग होते हैं उनसे?
Yeah. So hearing loss is a when you don't hear, you don't communicate with the people actually. So uh, when a person is having a hearing loss, so we do a audiogram, and we also do something called a speech audiogram, which is not commonly done in everywhere. So we try to see how much is the hearing loss. This is a mild hearing loss. 10 to 20 to 30 dB loss is 30 to 50 moderate, or 50 to 70 is severe, and more than 70 is a profound hearing loss. So if a person is having mild hearing loss, he can get away with not much of a problem. But if a person is having a moderate to severe hearing loss, it will affect his day-to-day activities. Many times we have seen that person avoiding going into the social gatherings. They don't go to the kitties and all. They start saying isolating themselves. And if a hearing loss is not touched upon for a long time, person can go into depression also, because they don't communicate with the people. So if it's a sensory hearing loss, it's a nerve thing, there is no medicine for that. So you will have to use something called hearing device, or the sound amplifier, so that can amplify the sound and can put inside the ears, and you can hear well. But when you have something called perforation in the ear, and you have a nerve loss also, that's called mixed hearing loss. So if you can repair the drum, and your nerves are fine, then you can start hearing well. So we do a surgery which is called tympanoplasty, in where we repair the drum. We take a fascia from the muscles and we repair the drum. It can be done under local also, it can be done in general anesthesia also. We can do end oral also, we can do post oral also, if someone is very concerned about the cosmetic issues without having a scar. So we do repair surgery. It's a half an hour to 45 minutes procedure, very well rewarding surgery, and the person gets a lot of benefit after getting a surgery done. So in terms of his ear will not get discharged, and the hearing will also get improved. So that is called surgical wise. And if it's a nerve hearing loss, then this surgery has not much of a role. We advise for the hearing device. But if a person is having a severe to profound hearing loss, in this type of a patient, the hearing aid might not help. So in this type of patients, it's a postlingual subs profound hearing loss. We do something called cochlear implant. So cochlear implant can give you a very good result in terms of a hearing, where the hearing aid might not help you. And in children's who are born with a bilateral profound sensory hearing loss, which have no words and speech and all, the cochlear implant is a boon for them. Actually, it's a great thing which the science has found out, to give a hearing to a deaf and dumb child, because जो बच्चा सुनता है वही बोलता है. If a child will not get a hearing, he will not speak. So the cochlear implant is a very good thing, and we can have a good discussion in cochlear implant sometime later, ma'am. It's like,